Assalamualaikum warahmatullahi wabarakatuh. My name is Irna Khairunissa DAMAYANTI. I'm from the Psychology Department. In this exam, I will discuss Alice in Wonderland syndrome. Let's get started. Alice in Wonderland syndrome, or micropsia, is a disoriented state of nerves that affect the perception of vision in humans. It is named Alice in Wonderland syndrome after the title of Lewis Carroll's novels. Sufferers of the syndrome will feel that seeing their colleague body parts of humans, animal, immovable objects become smaller than reality. In general, the object being perceived appear very far or very close at the same time. For example, a sufferer sees his pet cat become as small as a mouse. This sign is also called Lilliput vision or Lilliput hallucination, which is named after the land inhabited by a 6-inch-tall creature in The Adventure of Gulliver, a novel by Jonathan Swift. The sign only affects perception, not eye mechanic. Perception is influenced by the brain's interpretation of the information obtained from the eye. In a temporary condition, this syndrome is often associated with migraine headache, brain tumors, and use of psychoactive drugs. Alice in Wonderland syndrome can be a major symptom of the Epstein-Barr virus. Next, for Alice in Wonderland syndrome sufferers, the optical system is completely normal cyclically. The syndrome causes perceptual changes that are different from the malfunctioning of the eye itself. AIWS affect the sufferer's sense in terms of sight, sensation, touch, and hearing, including body image itself. A prominent and often disturbing symptom is a change in body image. The sufferer may experience confusion about the size and shape of part or all of their body. Alice in Wonderland syndrome results in distorted perception of the size and shape of objects. Other possible effects and signs of the syndrome are migraine or use of hallucinogenic drugs and infection with mononucleosis. In addition, sufferers of the syndrome can experience Lilliput hallucination, which is seeing objects smaller or larger than their actual size. Alice in Wonderland syndrome is a perceptual disorder rather than certain psychological change in body system. The syndrome can be diagnosed when other physical cases are not found, and the patient feels the symptoms along with the migraine and feels pain during the day, or although it can also occur at night. Another symptom of the syndrome is sound distortion, such as every small movement resulting in a loud noise. Handling. There is no specific treatment for Alice in Wonderland syndrome. However, a doctor can prescribe certain medication to help treat an underlying health condition. Prevention. In people who experience Alice in Wonderland syndrome associated with migraine-type headaches, it is advisable to avoid things that are known to commonly trigger migraine attack in that individual. Some common triggers for migraine headaches are alcohol, sweeteners containing aspartame, certain cheese, monosodium glutamate or MSG, and processed meat. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.